If you are over 60, I want you to pause for a moment and ask yourself something. Do you remember exactly when you first started taking vitamin D3, magnesium, or K2? Was it a year ago, 3 years ago, or even longer? The truth is that almost no one is ever told when they should stop. No one explains whether you should take these supplements for 5 months, a year, or forever. After more than 20 years working with older adults, I have noticed something that the supplement industry rarely mentions. Some supplements help at the beginning, but over time they can quietly become a burden. In this video, we are going to talk clearly about when you should stop the 3 most common supplements: D3, magnesium, and K2. Before we answer the question of when to stop a supplement, we need to understand an important concept called supplement cycling. This means taking a vitamin for a period of time, then pausing, and starting again later. It may sound unusual, but in medical practice, this approach can help the body function more naturally. The first reason is adaptation. Just like 1 cup of coffee wakes you up at first, but after a few months you may need 2 or 3, supplements can lose their effectiveness when taken continuously. The second reason is hormone involvement. Some vitamins affect hormones, and long-term use can make the body depend on them instead of regulating itself. The third reason is avoiding side effects. Magnesium can cause diarrhea, while excess D3 can cause constipation. Taking a break works like a reset button. If you have been taking supplements for more than 3 months, leave a number 1 in the comments. Now we will look at whether K2, magnesium, and D3 actually need cycling. Now that you understand the idea of cycling, we start with vitamin K2, a small nutrient with a huge impact on older adults. If calcium is like building bricks, K2 is the worker who places each brick in the correct spot. Thanks to K2, calcium is directed to your bones and teeth instead of drifting into blood vessels or kidneys, where it can build up and increase the risk of serious cardiovascular problems. K2 works extremely well with vitamin D3. D3 helps you absorb calcium, and K2 makes sure the calcium is used properly. When one is missing, the benefits drop significantly. Unfortunately, most adults do not get enough K2 from food. We eat far fewer fermented foods today, and K2 is most concentrated in natto, miso, and aged cheeses. Research from Japan shows that people who eat more K2-rich fermented foods often have cleaner arteries and stronger bones later in life. This is why we must discuss how to supplement K2 safely and effectively in the next section. Given how important K2 is, many people wonder whether they should cycle it. At common doses of about 90 to 200 micrograms per day, K2 is generally safe for long-term use. At these levels, it helps guide calcium to the right places and supports healthy blood vessels, so most older adults do not need to cycle K2. However, there is one situation where a short break might help. If you are taking high-dose D3 together with K2, your body may need time to rebalance how calcium is distributed. Pausing both for a short period can help reset things before restarting with an appropriate dose. There is also an important warning. If you take blood thinners like warfarin or Coumadin, K2 can interfere with their effectiveness. In that case, you must talk to your doctor and monitor your INR regularly. Now that we understand K2, we move on to magnesium, the key to more than 300 essential reactions in the body. After learning how K2 directs calcium, we move to a mineral that plays an even more fundamental role in older adults: magnesium. This mineral is involved in more than 300 biological reactions, from cellular energy production, muscle relaxation and contraction, nerve signaling, to sleep quality and blood sugar control. Nearly every system in the body needs magnesium to work properly. If the body were a machine, lacking magnesium would be like running an engine without oil. It still works, but every part struggles and wears down faster. The problem is that half of people over 50 are deficient without knowing it. Poor soil quality, processed foods, and high carbohydrate diets all increase magnesium loss. Many symptoms often blamed on aging are actually linked to low magnesium. Poor sleep, night leg cramps, heart palpitations, unexplained restlessness, or sudden anxiety. Because its role is so broad, magnesium is rarely a supplement that needs cycling, and we will explain why in the next section. When it comes to magnesium, the biggest question is whether it is safe to use daily. For people with healthy kidneys, magnesium is considered one of the safest supplements. The body eliminates extra magnesium through urine, making harmful buildup very unlikely. Studies also show that certain forms are better absorbed and gentler on the stomach, especially glycinate, malate, and citrate. These are excellent options for older adults, while magnesium oxide is more likely to cause diarrhea and may not be very effective. For those with kidney disease, magnesium requires more caution because the body may not remove the excess efficiently. There are two reasons magnesium usually does not need cycling. First, it is water-soluble, so extra amounts are cleared naturally. Second, most adults are already deficient, so stopping often brings symptoms back quickly. Now we move to vitamin D3, a supplement with a completely different behavior than both K2 and magnesium. Now that you know why magnesium usually should not be cycled, we turn to a supplement that behaves very differently, vitamin D3. And before we continue, if you are still watching, leave a number 2 inches the comments. Small interactions like that help the video reach more older adults facing similar issues. D3 is a very special case. Unlike magnesium, D3 is not water-soluble. It is stored in fat tissue and the liver. This means that if you take too much, especially daily for long periods, your D3 levels can rise without you noticing. Many people end up slightly overdosed simply because they assume more is better. A key question for you is, how many IU of D3 do you take each day? 1,000, 2,000, or 5,000? Your answer determines whether you should cycle D3. In the next section, we will explain why D3 must be handled very differently from K2 and magnesium. After asking yourself how much D3 you take each day, it is time to understand its true nature. D3 is not just a vitamin. It acts much like a hormone, influencing hundreds of genes and playing major roles in immunity, bone strength, heart health, mood, and long-term disease risk. Because D3 is fat-soluble, the body stores it in fat tissue and the liver instead of eliminating it quickly. These stores can remain for weeks or even months. This is a major difference from vitamin C, which the body flushes out rapidly when in excess. Studies published in the American Journal of Clinical Nutrition and the Journal of Clinical Endocrinology and Metabolism show that D3 levels remain elevated long after supplementation stops. The long half-life of D3 makes buildup possible if the dose is too high. For this reason, D3 is not something you should take daily out of habit. In the next part, we will look at when and how to cycle D3 based on your blood test for 25-hydroxyvitamin D. Now that you understand how D3 accumulates, the most important question is, when should you cycle it? The best method is a blood test, specifically 25-hydroxyvitamin D. If your level is consistently above 50 nanograms per milliliter, it is time to adjust. There are 3 safe options. First, pause for 2 to 4 weeks, especially if your level is high. Second, lower your dose to around 1,000 to 2,000 IU daily instead of 5,000 IU. Third, take it every other day. A study by Reinhold Vieth in 2001 showed that alternate day dosing keeps D levels stable without causing accumulation. D3 needs vary widely. People with darker skin may need more than those with lighter skin. Those living in northern climates need more than those in tropical regions. Winter requires higher intake than summer, and older adults absorb D3 less efficiently than younger adults. This is why blood testing is the ideal way to decide whether to stop, reduce, or cycle D3. When discussing D3 and magnesium, there is something many people overlook. The body always sends warnings before things go wrong. One early sign is unusual fatigue. You take vitamins hoping to feel better, but instead you feel drained. This often happens when the liver is overloaded by too many supplements at once. The second sign is digestive problems like bloating, nausea, diarrhea, or constipation. Magnesium oxide often causes diarrhea, while excess D3 can lead to constipation. The third sign is sleep disruption. Using the wrong form of magnesium or too much D3 can disturb your internal clock. The fourth sign is irregular heartbeat caused by mineral imbalances. And the last sign is a vague sense that something is off even though you are taking vitamins regularly. If you notice these symptoms, pause all supplements for 1 to 2 weeks and observe how your body responds. Before we finish, here are the 3 most important points for safe supplement use. For K2, it is generally safe for long-term use at common doses because it guides calcium to the right places and does not usually accumulate. For magnesium, older adults should not cycle it unless they have kidney disease and need medical supervision, because magnesium supports more than 300 essential reactions. For vitamin D3, personalization is critical. D3 behaves like a hormone and is stored in body fat, so regular blood testing is necessary to adjust your dose or cycle when levels become stable. Above all, listen to your body. Each person responds differently, and your body always sends signals before problems appear. Before we close, I want you to share something simple. Among the 3 supplements we discussed, which one have you taken the longest? And have you ever experienced any signs of overload? Your experience may help many others in the same age group. Remember, supplements are like seasoning in a meal. When used in the right amount at the right time, the body responds very well. But if you add too much, the entire dish becomes unbalanced. Everyone needs to find the combination that works best for them. If you found this helpful, please like, subscribe, and turn on notifications for upcoming videos. You can also explore the playlist on D3, K2, and Magnesium in the description below. Thank you for watching. This video is for educational purposes and does not replace medical advice. If you have underlying conditions or take prescription medications, consult your healthcare provider before changing your supplement routine.